this is a case of a gentleman who had received prior chemotherapy for lymphoma. It's a classical case of therapy-related AML. The case describes a gentleman who's 67-year-old, had treatment for lymphoma with CHOP chemotherapy 3 years ago, and now developed leukocytosis. And the workup reveals that he has acute myeloid leukemia, which in that context, most of the time is considered therapy-related AML. Therapy-related AML or MDS is an entity recognized by the WHO classification as separate type of leukemia or MDS. There are a couple of types we see. One we call type 1 that we see usually 5 years or after treatment. We see with patients that are heavily treated like autologous stem cell transplant. The risk varies, but could be up to 10 or 15% in patients with like Hodgkin lymphoma treated for transplant. And there is type 2 that we typically see earlier on, within 3 to 5 years of the initial therapy, and related mostly to chemotherapy like topoisomerase inhibitors, like anthracyclines in CHOP chemotherapy. And those usually typically present with more a AML phase rather than the MDS phase. Why certain patients develop therapy-related AML or MDS, we don't exactly know. It seems some of those patients may have already had mutations at a very small level or low level, and with the chemotherapy, those clones will expand and get subsequent hits and develop therapy-related AML.